team. This is Dr. Mikhail Higgins. So happy to be with you on my second YouTube video ever. So here we are talking about all things fibroids. And so big question that people always ask me is like, how do I know that I have fibroids? And it's a fair question. Why is it a fair question? Because most women are not aware that they actually have fibroids. So when you talk about sort of the epidemiology of fibroids, about 70% of white women have fibroids and will experience a fibroid, at least one, at one point during their premenopausal life. So what does that mean? 7 out of every 10 white women that you see will develop a fibroid at least one time during their premenopausal life. Okay, now when it comes to women of African descent, any woman who has an African heritage, okay, women who are black, women who are sort of black appearing, anybody who has this sort of ancestry, 80%, 8 out of every 10 will develop fibroids at one point during their life. When it comes to Asian women and Latino women, they are right up there in those percentages, 30 to 60% as well. When you look at those numbers, the question is, well, what percentage of those women actually become symptomatic to the degree that they know that they actually have these fibroids? Well, the number that people always talk about in the literature is about 30%. So about 1 in 3 of those women, if you sort of talk to them, they'd be like, Higgins, I know something's wrong, something's real wrong. And so they may say, you know what, I need to go to the doctor. Give me a little ultrasound, check what's going on the inside there. These are the women who say, you know what, I actually know something's out of whack. I'm sort of aware of my body. This is not how it used to be back in the day. I could see that things are changing. And so they check up and they find out that they actually, you know what, they get that confirmation that they have fibroids. So is that to say that the other 2/3, the 2 women out of that 1 woman in that group of 3 don't actually have the symptoms? No. One of the things that I've noticed in the work that I do is that women are so resilient. They will get accustomed and adapt to situations regardless of how burdensome they are, regardless of how irritating they are, because you know what? They don't want to complain. They don't want to cry for help. They just want to keep moving along. So this brings me to what are the things that you should be thinking about if you are in this sort of contemplative mode of, do I have fibroids or not? First and foremost, fibroids present with 2 main categories of symptoms. The first is what? The bleeding menstrual symptoms, and the other is what? The bulk symptoms, the compressive symptoms secondary to the weight of the fibroids, the sort of mass effect of them. So when we talk about what? Bleeding symptoms. If you are a woman and you're wearing regular pads, and you're maybe changing out of necessity for 3 or 4 or more times in a 24-hour period, the bleeding is soiling the pad greater than 50%. I would say you want to be thinking that maybe this is considered to be heavy bleeding. If you're a woman who needs heavy absorbent pads, overnight pads, or depends, you have heavy periods. And you may want to consider that perhaps there may actually be something provoking these heavy periods. You know, when I have women that have been treated, one of the biggest things, and I just actually was corresponding with a woman today, and she said, you know, last month when I had my period, you know, during those 5 days, I just had spotting. That's your period, my dear. That's what it was supposed to be. The sort of, you know, 20% of the pad being soiled, you know, changing it, you know, one time in 12 hours and then again overnight, you know, 2 pads in a 24-hour period, that's your normal period. And she was just like, oh my goodness, this has never been the case. So what do I want to know is I want you to be thinking, are your periods sort of heavy to the point where you need, again, heavy absorbent pads, overnight pads, depends. You could be experiencing what we call menorrhagia, heavy menstrual bleeding, so it is out of proportion to what is considered normal for you, okay? That's the first thing. If that heavy menstrual bleeding is causing things like anemia, then you may get what? You may start getting shortness of breath. Because why? Your heart is feeling the need to pump the volume of blood that you have in your body, because it's lower than it would normally be, faster during times of increased strenuous activity. Walking to the park, walking to your car, walking upstairs, things of that nature. If you find yourself in a gym and you feel like, wow, I'm getting a little bit more short of breath, doing little things like being on the treadmill, you may be developing symptomatic anemia. If you're beginning to feel lightheaded, you go from sitting to standing position, head is down, head comes up, and you feel a little lightheaded. Ooh, this may be just a little wooziness that may be secondary to what? The symptomatic anemia. Other things that may occur, in that same setting where you walk into your car in the parking lot, you're walking upstairs, you may also be feeling that what? You're getting a little short of breath. Oh my goodness gracious me, like what's happening here? This is your lungs beginning to work a little harder to do what? To actually get more oxygen to your tissues. Because why? Because your heart is working hard to get that same amount of blood flow around your body per second. Your lungs are saying, you know what? I need to oxygenate the tissues a little bit more because there's less circulating blood carrying capacity. Because why? You're losing what is considered to be normal in the form of your period. Make sense? Good. So those are the symptoms that are related to sort of the menstrual bleeding. So if we take a shift from the menstrual bleeding now to these bulk symptoms, the bulk symptoms are like things that would be, if you imagine these big muscular fibroids pressing on structures, pressing on your bladder, pressing on your rectum, then the symptoms are going to occur because of the fact that they are pushing their weight around, so to speak. If they press on what? The urinary bladder. So your bladder getting nice and big, maybe it's 10 glasses of water before you feel like you got to go. You may be like, oops, sad face, fibroids are pressing to the point, but maybe after 4 glasses, you gotta go. So the bladder is saying, oh, well, 4 glasses, I gotta go, squeeze, okay? So that urinary frequency is something that you would sort of typically experience after 10 glasses, but now you're experiencing it after 4 or after 3 or after 2. Now, constipation is one of those things that we talk about because of the fact that if you have a nice open rectum, stool is coming down your rectum, nice good bowel movement, nice open unimpeded rectum. Now if the fibroids are pressing posteriorly towards the back where the rectum is, maybe the rectum looks like this, a little bit of a bottleneck, right? So then you have a backup, unfortunately, where you can't really have an easy bowel movement. So I have women coming to me and saying, you know what, I have 3 bowel movements a week. No, I have 2 bowel movements a week. I have 1 bowel movement a week. I literally have 2 patients that have told me prior to seeing me, wait for it now, 1 bowel movement a month for the 4 years to 6 years prior to seeing me. And if you look at their imaging, you can see it's very clear that they have this backup of what? Stool in their colon because of this obstruction at the point of the rectum, because this fibroid is literally not letting off the rectum. So those are some of the symptoms. And then when you think about sort of women, in terms of sort of the disfiguring appearance, it's because what? If you were to pour marbles underneath the carpet and walk on them, you're like, oh, this is kind of weird, okay? So those marbles underneath the carpet were gonna prevent you from being able to flatten that carpet out. Now, you feel a woman's abdomen who has fibroids, it's almost like a little lumpy, bumpy, peanut brittle kind of situation going on there because what? The fibroids are underneath the abdominal wall. And so you could do all the sit-ups you want, you could do all the jumping jacks you want, and you will never lose that tummy to the degree where you don't see those fibroids anymore. So that bloating, that sort of disfigurement, that abdominal protrusion is obviously one of those things. You put your finger on your abdomen, you press on it, you're gonna feel those muscular fibroids pushing back. So when you think about pain on intercourse, that's also another symptom that women talk about because of just the weight of the fibroids on the uterus. So what do we have here? We have the constipation, we have the bloating, we have the decreased urinary frequency and urgency, we have the pain on intercourse in the form of the what? The bulk symptoms. And then we have the one that I literally am not a fan of, but it just comes with the territory, which is miscarriages. Being able to sort of have these fibroids in positions whereby when you have a fertilized egg, a baby that just wants to become a baby, it can't grow because of the fibroids being present. And so what is promoted? You get this provocation of miscarriages. So these are sort of symptoms related to the bulk symptoms due to fibroids. So we had the bleeding symptoms, the symptomatic anemia caused as a result of that. We have the bulk symptoms. So these are the things that I want us to think about. So I invite you to see your interventional radiologist, i.e. that would be me, your gynecologist, and really discuss your options. Of course, everybody knows about hysterectomy and myomectomy, the surgical solutions, but what about uterine artery embolization? And what we offer, the minimally invasive treatment that was developed in 1995 in France as a way to actually make myomectomies and hysterectomies safer from the standpoint of complications. What about this definitive treatment that just uses a 2mm incision that runs a catheter through your blood vessels and actually treats the whole issue, the whole problem, i.e. all of the blood vessels that actually give rise to the fibroids, that the fibroids essentially grow along? What if there's a way to actually treat that whole entire vascular network to the point where what? The whole fibroid conglomerate, the whole fibroid network and the ecosystem that actually gives rise to the fibroids, what if they can actually be treated holistically in that process? That's what we offer at the Bahamas Fibroid Interventional Clinic. And certainly if you're interested in learning more and having a consultation, just continue to subscribe, comment below. Would love to continue, obviously, our dialogue, and can't wait to talk more about this with you. Fibroids. Talk soon.